Good day, I am Josel I. Carbonell from BSN 1B. So for today's video, I'm going to demonstrate to you how to assess vital sign. And for the assessment, we need to assess the clinical sign of hypothermia, site most appropriate for measurements, factor that may alter core body temperature. In planning, the equipments are thermometer, alcohol, cotton balls. Good day, I am Jocelyn Carbonell from Nueva Ecija University of Science and Technology, and I will be your student nurse for today. So, can you please state your name, sir?
Jorel Carbonell.
So, Mr. Jorel, I will be getting your body temperature to check how well your body can make and get rid of it. But before that, let me perform hand hygiene.
Clean the thermometer and place the thermometer to appropriate route or site. Wait the appropriate amount of time. When the electronic and tympanic thermometer will indicate that the reading is complete through the light or tone. After that, remove the thermometer and discard the cover or wipe with a tissue if necessary. Then document or read the temperature. If the temperature is absolutely too high, too low, or consistent with the current condition, we check it with a thermometer known to be functioning properly.
So, Mr. Jorel, your body temperature is 36.2 Celsius and that's normal. So, thank you, Mr. Jorel. That's all for today. For the evaluation and documentation, document the temperature in the vital sign record sheet. Then, report abnormal result to the primary care provider. Lastly, document the procedure in the client record. For the assessment, assess clinical sign of cardiovascular alteration other than pulse rate, rhyme, or volume. Factor that may alter pulse rate. Site most appropriate for assessment. In planning, we need to prepare watch, alcohol, cotton balls. Good day, sir. I am Jocelyn Carbonell from Nueva Ecija University of Science and Technology, and I will be your student nurse for today. So, can you please state your name, sir?
I'm Jorel Carbonell.
Okay, thank you. So, Mr. Jorel, I will be getting your pulse rate to measure your heart rate. So, before that, let me perform hand hygiene.
Select pulse point. Palpate and continue the pulse. Place 2 or 3 middle fingertips lightly and squarely over the pulse point. If taking a client pulse for the first time when obtaining baseline data, or if the pulse is irregularly, count for all full minute. the pulse, rhyme, and volume. After that, document the pulse of the patient.
So, Mr. Jorel, your pulse rate is 86 and that's normal. So, that's all for today, sir. Thank you. For evaluation and documentation, document the pulse of the patient in the vital sign record sheet. Then, report abnormal result to the primary care provider. And lastly, document the pulse rate, rhyme, and volume and your action in the client record. For the assessment, assess skin and mucous membrane color, position assumed for breathing, sign of cerebral anorexia, chest movement, activity tolerance, chest pain, dysopenia, medication affecting respiratory. In planning the equipments, watch with a second hand or indicator. Good day, sir. I am Josel I. Carbonell from Nueva Ecija University of Science and Technology, and I will be your student nurse for today. So, can you please state your name, sir?
I'm Gerald Carbonell.
So, Mr. Joral Carbonell, I will be getting your respiratory rate to know the numbers of breath you take per minute. So, before that, let me perform hand hygiene.
Observe and palpate and count the respiratory rate. If you anticipate the client's awareness of respiratory assessment, place a hand against the client's chest to feel the chest movement with breathing, or place the client's arm across the chest and observe the chest movement while supposedly taking the radial pulse. Then, count the respiratory rate for 60 seconds, and inhalation and exhalation count as one respiration. Next, observe the depth, rhyme, and character of respiration. After that, observe the respiration for depth with watching the movement of the chest. Observe the respiration for regular or irregular rhyme. Observe the character of respiration, the sound they produce, and effort they required. After that, document the pulse of the patient in vital signs record sheet.
So, Mr. Jorel, your respiratory rate is 16 and that's normal. So, that's all for today, sir. Thank you. For evaluation and documentation, document the pulse of the patient in the vital sign record sheet. Then, report abnormal result to the primary care provider. And lastly, document the pulse rate, rhyme, and volume and your action in the client record. And again, I am Jocelyn Carbonell from BSN 1B.